Aloha, welcome to the October 5th edition of the Senior Council Division Coffee Hour, featuring Taryn Kumamoto, who is a licensed independent agent with Premier Benefit Consultants, a Medicare insurance brokerage firm. She represents a variety of carriers, including AARP, United Healthcare, Devoted, HMSA, Humana, and Kaiser Medicare Plan. She's been assisting Medicare beneficiaries choose a medical insurance plan since 2008. Before becoming a Medicare insurance agent, she was a financial advisor with various companies for 8 years. She holds a Bachelor of Business Administration from the University of Hawaii at Manoa and her MBA in Business Administration from Chaminade University. She's a busy wife and mother of 2 young children and an active volunteer parent at her children's school. When she can, she enjoys exercise classes and golf with friends and family. She's been judging Hawaii high school cheerleading competitions for the past 20 years and has been a board member for the UH Letter Winners Club for over 15 years. Taryn, thank you so much for coming to share your mana'o with us.
Mahalo nui loa. Thank you everyone for having me. I'm so happy to be here every year. Thank you for inviting me. And I have a lot of information to share. As you folks know, some of you have sat in my presentation before, but if not, welcome. And I have a wealth of information to give you. So please know on the very bottom, I do not provide tax, legal, or financial advice. Please contact CMS, which is Center for Medicare and Medicaid Services, for special circumstance questions. And also, you'll see on my bullet point on the middle of the page, so there's no consultation fees if you do need to utilize my services. So in other words, Medicare says we cannot charge a fee to sign you up. So here in Hawaii, a lot of us want to help people enroll, right, into a plan. So therefore, we do not charge you a fee. There's no consultation fee. There's no obligation. So how do we make money? Well, when you're ready to sign up for a plan and you say, oh, Taryn, please help me sign up for X, Y, and Z plan, then as long as I'm able to enroll you, which is filling out the paperwork or online and signing you up, and I put my agent number there, then I receive a commission. So that's how I'm compensated, and you don't pay me anything. All the plans in Hawaii is the same. So whether you go through me or another broker, as long as that broker is licensed with that carrier, then it's the same plan. Okay, so that being said, let's move on to the agenda. And feel free to raise your hand or in the chat box, and Desmond or Scott, please feel free to interrupt me. So Medicare basics, what is Medicare? When are you eligible? When can you enroll? What is Part A and B? And then completing your coverage, what is Part C and D, a supplement plan versus an advantage plan, and how to choose a plan. So you see on the right side of your screen, that's what the Medicare card looks like. It has your name and an alphanumeric, and then the hospital A and medical B. So if you come across your Ohana and they're talking about Medicare and they bring out their Medicare card and it has their social security number on it, you will know that's an old card. So therefore they need to call Social Security or Medicare. So Medicare, Social Security is the umbrella for Medicare. So you can call either one and then request for a new card. So they should no longer have a Medicare card that has their Social Security number on it, okay? Let's go into the basics. So what is Medicare? So just remember, Medicare is a federal health insurance program. The federal government collects contributions through FICA, that's coming out of your paycheck, which is a combination of Medicare and Social Security payroll tax. Employees' share of the Medicare portion of the tax is 1.45% of wages. To qualify for Medicare, you are a U.S. citizen or a legal resident who has lived in the United States for at least 5 consecutive years, including the 5 years just before applying for Medicare, and you or your spouse worked 10 years, which is 40 credits in the United States, and are age 65 or over. Or people under age 65 that collect disability through Social Security, disability for 24 months, or anyone with ALS, Lou Gehrig's disease, or ESRD, which is end-stage renal disease, or kidney failure requiring dialysis. So in other words, many of my clients, yes, they're 65 and over and they have Medicare. However, I do have clients that are 20 years old, 30 years old, 40 years old, and it could be due to a disability or through kidney failure or ALS. So enrolling into Medicare, IEP, initial enrollment period. This one is important because a lot of people have the questions that they ask me. I'm going to turn 65, now what? So there's a 7-month period, and it starts 3 months before your birth month, your 65th birth month, and then your birth month, which is the 4th month, and then 3 months after you turn 65. So you can enroll into Medicare Part A, which is hospital, and you can only do Part A if you want. You don't have to do Part B if you have creditable medical and drug coverage. So again, when you're going to turn 65, you're like, okay, Taryn said something, what I need to do, you should at least sign up for Part A, which is hospital. And if you have credible coverage through you, a partner, your spouse, then you could defer Part B without penalty. The next column, special enrollment period, to avoid penalties. Anytime you're still covered by the group health plan and are Medicare eligible, you can enroll for Medicare A and B. So in other words, I have people calling me up and they're 66 and they say, okay, Taryn, I'm going to retire. So I said, okay, just wondering, you have Medicare Part A? And they go, oh no, I don't have Part A. Was I supposed to get it? And I say, it's okay. You won't have a penalty as long as you had the 40 quarters. But so they can sign up for Medicare A and B because now they're going to retire. And the second bullet, during the 8-month period that begins the month after your employment or coverage ends, whichever happens first, you can pick up Medicare Part B to avoid the penalty. And the third column, general enrollment period, which is we call GEP. This is between January 1st to March 31st. However, please know the coverage won't start till July 1. You may be susceptible to late enrollment penalties for Medicare Part B and D. So example, I like to give people examples and stories. So I have a few clients that called me up and they were past 65. They didn't have any medical coverage for whatever reason. And so when I finally met with them, I said, well, it's past, it was past March. We're already, say it was July, August, or September. Anyway, they can't get their Medicare, especially the B, until July 1st because there was no open enrollment period. Excuse me. So there could be certain other instances, like right now, open enrollment October 15th to December 7th, that they possibly could. So it just depends on the circumstance. I see so many different situations come up. So please contact Medicare or someone like me, a broker that can help you through that. Let's move on. So original Medicare. Part A is hospital. So it's 0 premium per month if you're eligible. If not, there is a premium from $278 a month or $506 a month. It depends on how long you or your spouse worked and paid into Medicare taxes. But this is the reason why. So it's 0 premium a month. Therefore, you might as well pick up Part A if you're eligible, right? So if you're going to turn 65, or let's say you're 66 and you forgot to pick up Part A or you didn't know, go ahead and pick up Part A hospital because there's no premium as long as you were Medicare eligible and you reached the 40 quarters. There is an annual deductible of $1,600 per benefit period, and it covers inpatient hospitalization, skilled nursing facility, home health care, and hospice. On the right of the screen for hospital, so the first 60 days, there's 0 coinsurance after you've paid the $1,600 deductible. Day 61 to 90, you're paying the $400 per day coinsurance. And then days 91 to 150, there's an $800 copay that you must pay while using your 60 lifetime reserve days. So there's something called lifetime reserve days, and you have 60 total days. After that, you have to pay all costs. So if you see after day 150, you have to pay all costs. With regards to Medicare Part B, so the premium is $164.90 a month. Oh, I'm sorry. Let me go back. Okay, $164.90 per month, and there's a $226 Part B annual deductible. So hot off the press, 2024 is right around the corner. Now it is $174.80 a month. So that is confirmed. 174.80. So roughly about a $10 a month increase from year 2023. So this medical includes doctor services, durable medical equipment, other medical and preventive services. So typically you're going to pay 20% coinsurance, and Medicare, the government pays 80%. So it's an 80-20, okay? And then zero copay for covered clinical lab services. Higher incomes may pay more for Part B and D. So let's talk about that. What's not covered? Before we talk about the B and D IRMA, what's not covered? Some of the benefits not covered by original Medicare include routine eye exam, eyewear, dental, hearing exam, hearing aids, cosmetic surgery, long-term care, unless you qualify by means of Medicaid status, and medication, which we call prescription drugs. Okay, Medicare costs are based on income. So you want to have your ears perked up, because this is very important for some of you that may have this IRMA. If your modified adjusted gross income, as reported on your IRS tax return from 2 years ago, is above a certain amount, you'll pay the standard Part B premium and an IRMA. What's an IRMA? Income Related Monthly Adjustment Amount, IRMAA. It's a surcharge added to the monthly Medicare Part B and D prescription drug premium. Social Security uses their income tax information from 2 years prior to determine if a surcharge is owed, in addition to the monthly Part B premium and Part D premium. The surcharge amount paid depends on your income tax bracket, whether you filed individual, married filing joint, or married filing separate. Oh, I have a question. Joyce, will you make PowerPoint available later? I can share it with Desmond, and then you folks that's fine. You folks can have it, but just keep it to yourself, because it's all 2023 information. Okay. Next slide here. Okay. This is the chart. So if you were planning to pick up Medicare Part B this year, which is 2023, you would look at your 2021 tax return. So you have individual, married filing joint, married filing separate. The Part B monthly premium may include IRMA, and the Part D monthly premium, which could include IRMA. So for example, if you filed individual and you made less than $97,000, or married filing separate in the first line, or your married filing joint and made under $194,000, your Part B premium would be $164.90 a month. And there would be no D or drug IRMA in the far right column. Let's say your income was a second row between $97,000 and $123,000 for an individual, or married filing joint was $194 to $246, and then married filing separate, there's nothing there. I know, it's a bummer. So if you're married filing separate, unfortunately, you go down to the fifth column, and it says $97,000 to $403,000. Then you look to your far right, and now you pay $527.50 a month, and then the $70 IRMA for Part D. Okay, so take a look at this. If you have any questions, feel free to open it up now, chat, raise your hand, just come on out. Because I always have a lot of questions on this screen. And on the very bottom, you see IRMA is based on your modified adjusted gross income, what we call MAGI. And your MAGI is your AGI, so line 11, plus your tax exempt interest, line 2A, would equal your MAGI. Because if you look at your 1040, there is no line item that says MAGI. So you're going to have to add line 11 plus line 2A, and that would equal your MAGI. So good so far? Okay. One more thing. So they're going to look back at your 2-year prior tax return, right? So if this is 2023, they're looking at 2021 tax return. Next year's 2024, they're going to look back at your 2022 tax return. Okay, do you see how this is working? The following year's 2025, Medicare is going to look back at your 2023 tax return. So you don't have to do anything. Medicare and the IRS will talk to each other and they'll adjust it. They'll adjust your Part B and D premiums. Okay, let's move on. So completing your coverage, this is offered by private insurance companies. So you have your Medicare supplement policy, also known as a Medigap. Then you can purchase a Medicare Part D drug plan, or you pick up a Medicare Part C called Advantage Plan. You will have to remember a Part C is an Advantage plan. In other words, you're going to see a lot of mailers come your way and it'll say, dear Scott, here's information on a Medicare Advantage plan. And you're like, what is a Medicare Advantage plan? You have to remember that's a Part C. Okay, Part C is Medicare Advantage plan. Again, it looks like this. You have your red, white, and blue card at the top. If you choose the option to the left, you're going to go with the Medicare supplement. You're going to buy a Part D drug plan. Then you're going to show 3 cards. You're going to have your 3 cards to show. Or if you choose the option on your right, which is the Part C, then you're only going to show 1 card because all your benefits of Medicare A and B are embedded into the Part C plan. Okay, so let me repeat. If you're going to choose the Part C Advantage route, you will only show your Part C card. You do not need to show your original Medicare card because those benefits are integrated into your Part C plan. And I have a question from Mitzi. I think this is regarding the IRMA. So does that change every year? Yes, the 2-year prior taxes, as we just went over, what is based on the 2-year look back, right? And so every year it adjusts annually. Thanks, Mitzi. So with regards to Medicare supplement, these started in the 1980s, offered by private insurance companies. They're also known as Medigap. So if you hear the word Medigap and Medicare supplement, it's the same product. There's 10 standardized national plans and the premiums usually increase yearly. It helps to pay for some or all of the out-of-pocket costs that come with original Medicare. It is a supplement to original Medicare A and B only. So remember, I told you, you have to show your Medicare A and B card and your supplement card and possibly a Part D drug card, right, if you need prescription drugs. Usually no extra benefits like free gym membership or vision. Those extra benefits you'll find on a Part C Advantage plan. And the plans vary by the state. If we choose the option on the right, which was the Part C Advantage plan, this is what's going to happen. So with the just information on the background, these plans started in 1997, or it was created in 1997 with the plan sales starting in 2006. And I came along in 2008, not when I was born, but when I started selling the plan. Okay, so in 2008, I started selling the plan. So just when it was early on created. So I've been in the business for 15 years now. These plans are offered through private insurance companies. Again, it pays instead of original Medicare. Remember I said you'll only show this Part C card. You don't show original Medicare card. However, it does cover all the benefits of original Medicare. So you're not losing any benefits. You're just getting more. It may include extra benefits such as dental, vision, hearing, gym membership, and emergency coverage outside the United States. And it may also include Part D drug coverage. The reason why I say it may is because we do offer plans that are Part C plans without prescription drug coverage. So you just need to let us know if you do want it with prescription drug coverage. Please remember, you must continue to pay your Part B premium. Okay, whether you choose a supplement, the supplement route, or the Part C Advantage route, you always have to pay the Part B premium that goes to Medicare. You must have both Medicare A and B to enroll and have a valid enrollment period. You must show your Part C Advantage card. The benefit is there's what's called a built-in safety net or an annual max out of pocket for hospital and medical only, meaning there is a cap. And it would be very similar to your employer medical plan. So your employer medical plan, normally you have an annual max out of pocket of $3,000. So if you ever had a catastrophic illness or event, And instead of paying $100,000 bill, you would be capped at $3,000. So same on the Part C plans. The annual max roughly anywhere from $4,000 to $7,000 to $10,000. So you want to check when you're purchasing your product, what is the annual max out of pocket. There's a catastrophic coverage amount for prescription drugs too. So we're not going to go into detail, but just know there's like these two amounts, right? The built-in safety net for hospital and medical, and then another catastrophic coverage for prescription drugs. This year, I think it was 7,400, and then next year it jumps to 8,000, and that's only for prescription drug coverage. It's best to use network providers to keep costs down. So we have something called a PPO, which is a preferred provider organization, where you can see doctors in or out of the network. And then you have a HMO, a health maintenance organization, where you just stay within that network of doctors. You may qualify for financial assistance. So some of your Ohana and your friends may say, hey, Taryn, yeah, I'm Medicare and I pay nothing for my plan. I pay no premiums. I pay no co-pays. So you're scratching your head. You're wondering, how did they do that? So they may qualify for financial assistance, and therefore they may not have to pay premiums or lowered premiums, and they may not have to pay co-pays. If you enroll in Part B or D late, you may incur late enrollment penalties. Oh my gosh, we're going to talk about this because this is very important, but in the next few slides. And a Medicare Advantage is not the same as a Medicare Supplement. So again, I'm such a stickler on this, because I've been doing this for so long. Some of you folks are my clients on this call, and right? I'm like, hey, remember, a Medicare Advantage is not a supplement, and a supplement is not a Medicare Advantage. So you cannot use those names, as the same product, because it's not. Regarding Medicare, COBRA, and the marketplace coverage, so most of you know what COBRA is, right? It's continuous coverage of your medical employer plan. So in case you want to, you're going to retire, you have up to 18 months. It must be offered to you if you're part of usually a medium to large employer plan. But you have to pay for it, right? You have to pay 102% of the premiums. You have 8 months to sign up for Part B without penalty, whether you choose COBRA or not. But if you miss this period, you have to wait till January 1st to March 31st. That's that general enrollment period, where it would be effective July 1st, but then you may have a gap in coverage, and you may also have a lifetime Part B late enrollment penalty. And with the ACA, the Affordable Care Act plan, it's against the law to have both a marketplace insurance and a Medicare plan. So it's when you turn 65 is the rules. You cannot stay on your ACA plan. In fact, you will get a letter from the carrier and it'll say, oh, dear so-and-so, you're turning 65. Great news. You're eligible for Medicare. You must now transition to a Medicare plan. Okay, TRICARE for Life. So you must be enrolled into both Medicare A and B to apply for TRICARE for Life. Medicare pays first, and TRICARE for Life may pay second. And if you get items or services from a military hospital or other federal health care provider, TRICARE pays first. VA, Veterans Affairs. So if you have both Medicare and VA, you can get treatment under either program, but generally Medicare and the U.S. Department of Veterans Affairs can't pay for the same service for items. You must choose which benefits to use. And just real briefly, HSA and the FSA. So the health savings account, a tax-exempt account to reimburse certain medical expenses you incur, which may be offered by your employer. To qualify for an HSA contribution, you cannot be enrolled into Medicare. FSA, flexible spending arrangements. Again, on the very bottom, you can't receive distributions from FSA or health insurance premiums. Cannot use it to pay Medicare insurance premiums. I don't get these questions too often. I think maybe in Hawaii, some of our employees don't use that often, or as they're getting towards Medicare. So I had to put that in because I couldn't remember. Okay, check-in questions. Yay, because Taryn's talking so much. You folks have to answer, okay, and unmute yourselves. Number 1, at what age should you enroll into at least Medicare Part A? Is it 62, 65, or 70?
You guys can just raise your hand if you want to answer, and then I'll unmute you guys.
Oh, everybody is on mute. Sorry, Desmond. or just type it in the chat. Okay. Oh, we got some good questions in the chat. Okay, before I look at the chat, so sorry, Desmond, they're all muted. Okay, how about this? I'll give you the answer. So at what age should you enroll into Medicare Part A? 65, right? So not 62, I mean, you can, yes, thanks, Robin. You can do 70. That's like, maybe you forgot or you didn't know, right? Trick question. But normally at age 65. Yes, thank you. Okay. And then I have a question in the chat. Do you need to sign up for Medicare if you have EUTF retiree coverage? Good question. When you have EUTF, and again, please contact EUTF directly. Normally, there's a couple things. If you're turning 65 and you're not, say you're getting the retiree coverage, right, and you're not working, then yes, you would normally have to pick up A and B, and then they would reimburse you the Part B premium. But if your spouse is still working, there's so much, I don't want to take too long, but it depends also too if the person is still active or retired for EUTF. So normally you'd want to pick up A and B, but contact EUTF to double check. Yes, thank you. And then did you say private employer will kick you off their medical, will kick you off your health insurance? Okay, will kick you off your health insurance coverage at age 65. Do you have to enroll in Part B? No, your private employer cannot bump you off or tell you have to leave your employer plan. So no, they cannot do that. By law, if you're working for an employer and you work the 20 hours a week for 4 consecutive weeks, then by law, they have to offer you medical. So you can stay on your employer plan, but in addition, you can pick up at least Part A, which is premium free. And I think Desmond may answer your question as well. Okay. And then let's see. Okay? Sorry, I'm going to answer these questions since I have this up. So Elton, I'm 62 years old. I'm sorry. I'm saying your folks' names. You got to tell me if you can't. I'm not going to say your last name. I'm 62 years old, retired from state, applied for Social Security. I heard they will automatically enroll me in Medicare. Is this true? Yes. So how this works is if you're under age 65 and you're collecting Social Security, you will automatically be enrolled into Medicare, which is a good thing. So you'll receive your Medicare A and B card in the mail roughly 3 months before your 65th birth month. So they're really good. They're sometimes they get it 4 months, but around 3 months before your 65th birthday. That's only if you're already collecting Social Security, okay? Then you're automatically going to get Medicare. But if you're not collecting Social Security and you're turning 65, you have to manually go to ssa.gov and apply for Medicare, okay? And so how does Medicare work with federal employees? Federal retiree, yes. So if you have retired federal plan, then you should at least pick up Part A, right? If you qualify, you work the 10 years or 40 quarters. But with regards to Part B, so again, this question is specifically for those who work in the federal, and it's up to you if you want to pick up Part B, because you don't have to, because you have retiree medical with the federal, and it's a very good plan. So you need to decide if you're going to pick up B when it's time, meaning you either turn 65 or you're losing employer coverage. So one of those two events, that's when you need to decide, whichever is later, I should say, because let's say you're 66, right? And then you're still working and then you're going to retire. So now if you're 66 or 67, you have a federal plan and it's now going to convert to a retiree plan, then that's the time that you need to declare you're going to pick up Medicare B or not. Because what happens is if you decide not to pick up B, then you don't do anything. You just don't pick up B, right? It's when you say a year later and maybe I should have picked up Part B. That's fine. You can go back into Medicare, pick up Part B, but that's when your penalty would start. And then the Part B penalty will be for life. Okay, so we can answer more of those questions. All right, so yes, let's move on. Wonderful questions, and I'm trying to keep us on time. So number 2, how do you sign Medicare? A, www.ssa.gov. B, call SSA for help. C, go down in person to the local office. D, all of the above. Desmond, what's your answer?
Oh, am I supposed to answer this?
Yeah, just say D.
Okay, yeah, D.
Okay, it's D. Okay, so you see how fun this is, because I like to do this for you folks every year. All right, number 3, is Medicare an individual plan or a family plan? Don't say it's a family plan. I'm gonna talk to you guys. It's an individual plan, okay? So Medicare is an individual plan. Number 4, is there a premium for Part B medical? And yes, the base premium for year 2023 is $164.90, or no, I worked 10 years or 40 quarters, so I don't have to pay a premium. I know it's kind of a trick question. So A, yes, you have to pay $164.90. That's the base amount. If you have higher income, you have to pay more. This is because you worked the 10 years and 40 quarters, yes, and you're entitled to Part A, okay? But you have to pay a Part B premium unless you qualify for Medicaid. Let's move on because we have a few more slides. Okay, so the summary, you have parts A and B, which we call original Medicare. So part A is a hospital, premium free if you're eligible. There are deductibles and coinsurance. Part B, we call medical. It's $164.90 a month premium for this year, 2023. Deductibles and coinsurance, yes, there is unlimited maximum out of pocket, meaning if you only had Medicare A and B and no other Part C plan, you didn't pick up a supplement plan, you didn't have a retiree plan, you don't have Medicaid, then unlimited max out of pocket. So if you had a big medical condition or surgery, and you see that bill and it says $50,000, then you would have to pay it, So again, it's an 80-20 coinsurance for Part B, meaning the government pays 80%, you pay 20%, but your 20% is not capped. It's just sky's the limit. And then there's no Part D prescription drug coverage under original Medicare. It's just A is hospital, B is medical. The second column, Medicare supplement, also known as Medigap. So it's a supplement to parts A and B only. It may pay some or all of your deductibles and coinsurance of parts A and B. The maximum out of pocket could be the premium if you choose the most comprehensive plan. And it was called Plan F, was the old plan, but some of you may still be eligible for it if you turned 65 or you had Part B before the year 2020. There's 8 different plans in Hawaii to choose from. The premiums are based on age. The premiums increase approximately 5 to 8% per year. There's no extra benefits such as free gym membership, and you must buy a separate Part D drug plan. And on the very bottom, again, you cannot have both a supplement plan and an advantage plan. It's either or. The third column, Part C Advantage plan. So it's a bundled plan, which includes parts A and B and most times D drugs. The premiums vary by the carrier. FYI, it could be anywhere from a 0 premium Part C plans. Yes, there are such a thing. And yes, they are still very good plans with a 0 premium Advantage plan. And then it can go up to maybe $200 something a month for Part C plans. Yes, there is an annual max out of pocket. These are the ones that I mentioned. It could be $4,000, $6,000, $10,000. So that's good. That means you won't pay more than that should you have a major catastrophic illness or event. May include extra benefits such as vision, dental, chiro, acupuncture, and free gym membership. And then the last column, the late enrollment penalty. So if you want to write this down, the Part B as in boy, right, which is medical, it's 10% of your Part B premium times a full 12-month period you didn't have Part B. So in other words, if you didn't have Part B for 1 year, 10% of $164.90 is $16.49 a month added to your $164.90 premium in perpetuity. Okay, so it's not a one time, it's for life. And then the Part D, the penalty for drugs, if you didn't pick it up when you were supposed to, it's 1% times the number of months you didn't have a Part D plan times $55, which is the average monthly Part D drug plan nowadays. The Part D example. So for example, 60 months is 5 years, times 1%, times $55 roughly is the average Part D drug plan. So that would be $33 a month. So again, a story, you know, I started doing this in 2008, and then I had a customer come, you know, to one of my workshops, and he said, oh, Taryn, you know, thank you for sharing the information with me. I like the Part C Advantage plan. I don't need a drug plan because I don't take any prescription medicine, so don't put on the drug plan. And I said, are you sure? Why don't we just put it on? You know, it didn't cost anything extra. And he said, no, I don't need it. It's fine. Because I think what it was is the Part C plan gave extra benefits when that plan didn't have a drug component. So we said, okay, then we'll just do that. So what happened though is, right, 5 years later, and that's why I put down this example, 5 years later, he did come back and he said, oh, shucks, Taryn, you know what? Now I started to take prescription drugs, and it's costing me $400 a month because I don't have a drug plan. So what can we do? So I said, okay, if we get a drug plan, at least your $400 a month, it will be less. It just depends on the co-pays of the medicine, but you will have a penalty, and roughly that's how we calculate it. So his penalty was roughly $33 a month for life, plus whatever the cost of a drug plan premium is. Okay, so let me just check the Q&A. And so when do you have to sign up for Part D if you are still working after age 65? Good question. So as long as if you're 65 and over and still working and you have credible coverage, right, for medical and drugs, then that's fine. You can delay Part B, but 63 days, write that down. 63 days. Once your employer plan ends, you have 63 days to pick up a Part D plan, drug plan. Otherwise, that's when the penalties would start. So if you pick up a Part C Advantage plan, which may include drug coverage, then that counts because that's the Part D within the Part C. Okay, so 63 days to avoid any late enrollment penalty for prescription drugs. Thank you. Great question. And a couple more slides here. Okay, so enrollment periods. IEP, we call initial enrollment period. That's a 7-month window, including your 65th birthday. You want to at least sign up for Part A. We mentioned even if you have employer medical coverage. Why? Because it's premium free. So as long as you worked or your spouse worked 10 years and you have 40 quarters, then you'll get hospital Medicare Part A premium free. So you might as well sign up for it. Number 2, AEP, which is going on right now. Annual enrollment period starts October 15th to December 7th. This is the time my clients are calling me and they say, Taryn, should I make a switch for my current plan? It would be effective January 1st. So if you folks are already on a plan and you're happy with your plan, you do not need to do anything. You'll automatically be re-enrolled for the following year. Number 3, open enrollment, which is January 1st to March 31st. This is not that general enrollment period I was talking about. This is something else. This is a time where, okay, this is what happens. So December 8th, right? I get the phone call from my clients, or even they're not my clients. And they say, hey, Taryn, I was referred to you by somebody and I want to make a switch. But I said, oh, it's December 8th. You missed the December 7th deadline. And they say, oh no, now what? Okay, so we have to wait until January 1st to March 31st, which is an open enrollment period. So as long as they had a Medicare Advantage plan, they could make a switch, a one-time switch during this time. And then the new plan will be effective the 1st of the following month. So it's still possible that you could make a switch. And then number 4, SEP, special enrollment period. So this depends on your situation. For example, if you if you retired and you're losing employer coverage, or if you're moving, this allows you to enroll into a Medicare Advantage plan or a supplement plan. Okay, and then completing your coverage. So once again, you have your Medicare card on the top. If we choose the option on the left, you have Medicare supplement and a Medicare drug plan. You will show how many? 3 cards if we go on the option on the left. Okay, if you choose the option on the right, you have your Medicare card, yes, and your Part C Advantage card, but you will not show your original Medicare card. You're only going to show your Part C Advantage plan. You do not have dual coverage when you pick up a Part C plan. And I'm sorry, I keep repeating myself, but that's because over 15 years of doing seminars, I get the same questions. And so I want to repeat myself so people get it and remember it, okay? But it does help. It does help that people say, thank you for reminding me that I don't need to show my original Medicare card when I pick up a Part C Advantage plan. So which plan should I choose? On the left, again, you have the supplement with a drug plan. So you don't mind paying higher monthly premiums in exchange for zero or little out-of-pocket costs for hospital and medical. But no, the premiums may increase 5 to 8% per year. The coverage goes with you anywhere in the United States. Why? Because you're showing the original Medicare card. You're showing this card, okay? The supplement card, there is no network. I don't need to look up your doctors. There's no doctor network to look up. The network I'm looking up is your original Medicare. So in other words, I go to medicare.gov and then you tell me all your doctors, and then I go there and look up, or you can too, but you go and look up your doctors and see if their names are in there. Do they take original Medicare? If so, that's great. Your supplement is only a supplement to original Medicare. You see what I mean? So people say, oh, Taryn, look up my doctors on the supplement plan. I said, I'm not going to do that. I'm going to look up your doctors on original Medicare, on medicare.gov. And then the prescription drug plan. So let's see, prefer to use specialty clinics on the mainland. You may have chronic health conditions and see doctors often. I'm sorry. And then you may anticipate surgeries. On the right side, Medicare Advantage. So it's all in one bundled plans. It includes hospital, medical, usually prescription drugs, vision, extra benefits such as dental and free fitness. You're in good health, minimal prescription medications. The premiums may vary from zero premium, maybe up to $200 something a month premium. There is an annual max out of pocket that provides peace of mind. And then the plans have provider networks that you must review. So that's the one I'm talking about, the PPOs and the HMOs. Okay, resources, medicare.gov. This should be your go-to website. I'm there every day. So there's a lot of information. And you know, the website is so good. It's gotten a lot better since 15 years ago. Let me tell you that. And then hawaiiship.org. So this is a nonprofit organization here in Hawaii. You can go there. You can also go down. I think there's somewhere in downtown. Maybe Scott knows where that is. Medicare Made Clear. This is a website by United Healthcare, one of the carriers that I'm represented with. And this site is really good too. And mybenefits.hawaii.gov. Okay, for our families that really need assistance, financial assistance, to possibly qualify for Quest, Medicaid, full Medicaid, partial Medicaid, this is a really good site for them to review as a resource and then to apply. Okay, so we have some Q&A. I'm sorry. So you use the phrase a one-time switch of your Advantage plan. Is that a lifetime limitation? One switch and then you're stuck? No. So thank you for clarifying. The one-time switch is for that year, for that calendar year. Yes. So let's say again, you have October 15th to December 7th. And during this time, many people go to different seminars, right? And you want to research which plan you want. So let's say you went to one seminar and say, oh, that plan sounds great. And you sign up. And then a couple weeks later, you go to another seminar and you're like, oh, wait a sec, this one actually might fit me better. You can sign up for that next plan and then that will be effective. So during October 15th to December 7th, it's the last plan that you enrolled in will be effective January 1st. Then let's come January 1st to March 31st, right? This could be maybe buyer's remorse. it could be the time where, oh, I forgot to do the switch because I was on a trip, right? So the one time, meaning between January 1st and March 31st, you have a one-time switch saying you can't switch again. Like say you went to one seminar and another seminar, you can't switch. You only can choose one plan. It'll be effective the first of the following month. And then yes, you are on that plan until the end of the calendar year. So thank you so much for clarifying. And my last few slides. Number 1, tips and reminders, or as the young people say, hacks, right? I never knew I never understood what they were saying. So hacks, just FYI, is tips. Okay. So number 1, sign up for Medicare Part A, which is hospital at age 65, even if you will still have employer medical through your own or through your spouse. You can do this 3 months before your birth month. Again, go to www.ssa.gov. That's where you would do it. I do not do it for you. I can't do it for you. So you go to ssa.gov. But if you need clarity, like how do you do it? I can tell you how to do it over the phone. Number 2, show your Part A Medicare card in addition to your employer medical card if you ever have hospital services, as you will have dual coverage, right, for hospital. And then number 3, contact me or someone like me 3 to 6 months before you lose employer medical. So I'm assuming you're working past 65 and you're ready to retire and travel or even stay home, but not have to work anymore. So then we need to put on Part B. It's a 2-step process. We need to put on Part B and your supplemental plan or advantage plan, right, at the same time. And then number 4, if you have retiree medical coverage from a private employer or union, you do not need to pick up Part C Advantage or supplement plan. Doing so may cause you to lose your retiree medical plan, except for the Fed. So if you are a federal retiree, you can have A and B and a Part C Advantage plan. That's fine. You will not get bumped off. I'm talking about people in the city or state or union. Therefore, when you pick up A and B, you don't want to pick up Part C because yes, it could bump you off your retiree medical plan and then you may not be able to get it back. So we don't want that to happen to you. So again, mahalo nui loa. It's been a pleasure. I always enjoy speaking with you folks, and thank you so much for having me every year. I try to add those questions, my little quizzes in there to make it more fun. But here's my information. So my mobile, feel free to, texting is best, but you can also leave a message or email Taryn@pbchawaii.com. The office number is there. The website is there, but these are the different plans that I represent. United Healthcare, Devoted, HMSA, Humana, and Kaiser, which are all Medicare plans. And please note, PBC, which is Premier Benefit Consultants, we are the exclusive contractor for HMSA. So in other words, if you meet a broker like me and they're not part of our Premier Benefit Consultants, because there's many brokerage companies, they cannot offer you HMSA. So the only way you can get an HMSA Medicare plan is either you go down to HMSA or seeing someone like us who's at PBC, Premier Benefit Consultants. Free consultations. Again, we cannot charge you a consultation fee if we're going to help you enroll into a plan. Please know this information is for personal use only. I do not provide tax, legal, or financial advice, and please contact CMS, which is Center for Medicare and Medicaid Services, for more in-depth questions. Thank you so much. We can open it up to Q&A, or you can feel free to email or call me at your convenience. Thank you so much.
Looks like we have some questions in the Q&A function. So
Q&A. Yes. So I think for Elton, all decisions are automatically made for me. Well, Elton, I think your question was on Medicare. So you will automatically, if you're still on the line, you will automatically get Medicare A and B because you signed up for Social Security. But if you don't have a retiree medical plan, we still need to help you pick up a Part C Advantage plan or the supplement plan with a drug plan, right? Okay, so I hope that if you have additional questions, please feel free to reach out to me. And then do you have, the next question, do you have to reside in the United States to receive benefits? Yes. So I don't know how they do it, but I get emails from the carrier. So after I sign someone up for a Part C plan, or even a supplement plan, but I get emails from the carrier that says, we know your client has not been in the States for a very long time or something. Please reach out to them because they will cut your Part C Advantage plan off. So I don't know how they know that. Maybe I don't know, I can't say. But so you need to reside in the United States. So what happens is I have people who's come to me and they reside in another country. So this is the detail part. If you have an address with Social Security, which I assume you do, right? Then that's how you can sign up for these plans. But if you're not actively living here, that's when I notice I get those emails from the carrier. So, and then they end up cutting off my clients on the Part C plans. So you'll still have original Medicare, but I'm talking about the Part C Advantage plans or the supplement plans. So please let me know if I did not answer your question to the full extent, and you could maybe email me or call me. So thank you for that question. And then the next question, I heard you say consultation with you is free, but if someone signs up and you take care of paperwork, you will receive a commission from me or Medicare. Yes, so please let me clarify. Thank you so much. So we don't charge a consultation fee because Medicare says if you're going to enroll somebody, you can't charge them a fee. That's the rules. So if I'm going to help you enroll in the future, then I can't charge you a consultation fee. I'm paid in the form of a commission from the insurance carrier. So if you say, oh, Taryn, okay, after we reviewed all the different plans, I want X, Y, and Z plan, then X, Y, and Z plan will pay me in the form of a commission. So again, you don't pay me anything. You don't pay a broker any type of commission or consultation fee. So thank you for that. And then the last question, if you were covered by your spouse and they retire, is it better to get my own insurance or go to Medicare if you're over 65? So if you're covered by your spouse, okay, I have a lot of questions going on in my mind with that question. So if you're covered by your spouse and they retire, if you're over 65, so if you're 65, if you are working, then you could ask your employer, right, how much it would cost to get medical insurance on your own. Unless your spouse has retiree coverage, that's another one. Or again, the third option would be looking into getting Medicare for yourself. Yes, so great question. Wonderful questions, everyone. Anyone else? Feel free to chat, text, email, call. Feel
All right.
free anytime. Thank you.
All right. Thank you, Taryn. Scott, do you have any parting words for today?
Yeah, Taryn, awesome job as always. Thank you so much.
You're welcome.
Very informative, mind-boggling at times, but very informative. And we're very fortunate to have people like you to help guide us through the process. Because I've been through the process and it's no fun for sure. Well, thank you all for attending. Next month, in November, our coffee hour is going to feature Judge Wadsworth from the ICA talking about appellate practice. So that should be really interesting, and we'd really love to have you attend. So you'll be getting notices of how to sign up for the Zoom meeting. And until then, ahui ho.
Ahoy ho.
All right. Thank you, everyone.